As the patient lays there in that hospital bed, they wonder what's going to happen. The patient needs critical surgery to restore their health and well-being, yet they are told that there can be a lot of complications associated with surgery. One such complication can come from blood transfusions that many patients need during surgery. Are the doctors going to tell them in order to do the surgery they are going to need a blood transfusion? As the patient lays there, they feel weak, defeated, and hurt. Laying there wondering would the blood transfusion hurt them even more, or would they survive to see another day? They don't want to hear the negative effects of a blood transfusion. They don't want to hear that there might be a 50% chance of getting an infection or disease from the transfusion. They want to hear that they will live to see another day and everything is going to be just fine. The doctor walks in the room to inform the patient they will not need a blood transfusion. Good morning. How are you feeling today?
I'm okay. It can be better. Hopefully you're in here to tell me some good news and get me out of here.
I am actually. I'm here to tell you that based on your results from the test you took, you will not need a blood transfusion.
Really? So that means...
That means you're not at risk of having any infections and you'll be just fine.
What if I needed the blood transfusion?
If you had needed the blood transfusion, there was a 50-50 chance of you getting affected with HIV, hepatitis B and C, fever, iron overload, lung injury, acute immune hemolytic reaction, delayed hemolytic reaction, graft versus host disease, which includes a high fever, a rash, and diarrhea. It all depends on what the person had in their blood. Luckily for you, there is nothing to worry about. 2 hours later, the doctors are performing surgery on a patient. After 4 hours of operating, the surgery was a huge success. 2 days after the surgery. Hello, how are you today?
Much better, and I feel good.
Well, I have some great news. From all the tests we ran on you, it shows you are able to go home next week.
Doctor, I thank you so much. You have been outstanding.
Thank you. It's my job to make sure my patients are well taken care of.
I just hope when I go home, everything will be back to normal.
It will. And the next time I see you, I hope you're just coming by to say hello and not to be admitted.
I hope so too. Thank you again.
No problem. And before I go, I just want you to always remember something. Bank blood cannot perform the most important job transfuse blood is supposed to.
That was nice. Where did you get that from?
That was told by Daily Herald. You don't always need a blood transfusion to survive. If you did just fine, you take good care of yourself.
I will, and thank you.
Next week comes and everything but the patient is back to normal.